Okie dokie. And we are live. And can you hear me, Marnie, still?
I can. Yep.
Okay, perfect. All right. So my name is Alison Coombs, and I'm the founder. This group used to be called the Moms with IC Support Group, but I've opened it up to women of in all stages. So women with interstitial cystitis, pelvic pain, and pelvic health support group for women is what it's called now. And we're here with the lovely Marnie, who runs Pelvic Health Support Canada. And she is a fellow IC warrior, so I thought that it would be great to have her pop on to share her story as well as the website that she has founded for great information for people who have pelvic or bladder pain or any sort of pelvic health concern in general. All right, so Marnie, why don't you go ahead and share a little bit about your IC journey with everybody here?
Yeah. Okay. So basically, I was 22 years old at Western and in London, Ontario. And I started experiencing symptoms of urgency, frequency. I thought I had a bladder infection and it just wasn't going away. So I had a cystoscopy. The first one I had was not with a general anesthetic, which I highly recommend people definitely ask for because it is not a fun experience without one. I know doctors are sometimes hesitant to give general anesthetic, but if you do feel like you have a condition like IC, I would say just really try to get that general as opposed to the local anesthetic, because often you'll have to have it done. Did you have the same experience, Alison? Were you?
Yeah. I was
Yeah,
gonna say I had the first time the nurse I remember saying, "Oh, this is going to be a little bit uncomfortable," and I was like, "Oh, what do you?" That
right.
was a little bit that was hurt. That hurt. So the
Yeah.
second time, I don't know where I heard the tip, or maybe the doctor recommended it to me. It was a doctor. So then, such a different experience just to be put out and do it because I didn't feel anything. It's great.
Yeah. You feel it after, but during
Yeah.
it's just you don't feel a thing. And they can do the hydrodistension, which is often necessary to diagnose. And until afterwards, and then you can take painkillers and take baths and, relax the muscles. But yeah, I highly, that's one thing I always tell people is definitely get the general if you can. Um, and so then I was diagnosed, not that time because they couldn't finish the procedure. I was diagnosed in the spring of 2023. And so at that time, I was like, wow, I'm 22 years old or 20. I had just turned 23. And here I am with this chronic condition that no one seems to know anything about. And this was, back in the early 2000s when pelvic physio wasn't a big thing and there just wasn't a lot of even social media. It existed, but it wasn't like it is now. So I felt very isolated. I felt like I was the only, 23-year-old with this condition. It affected my sex life. It affected my mood. I became quite depressed. And it was just a really hard it was a hard condition to grasp, but a hard condition for people to understand and for people to relate to. So they're like, oh, you just have to pee all the time. And I said, well, it's a bit more complicated than that. And I'm sure, Alison, you can uh, empathize there because it's not just that simple. Um,
Hmm.
which is, I think, a lot of people, who don't understand the condition are just like, oh, that sounds like more of a nuisance than anything else.
Yeah,
Uh,
they don't quite get the pain aspect or the burning or the tiredness, the
the sleep
achiness.
deprivation, yeah,
Yeah.
it's not an easy condition. So, years later, we're going quite, so I basically took amitriptyline and that worked well for me. I increased my dosage after a certain period of time. And, a lot of people don't feel comfortable on that drug because there are a lot of side effects. But I find that, after a while, you kind of acclimatize to it. So sometimes it's worth, dealing with the side effects. A lot of people worry about, the weight gain, and the tiredness. But, for a lot of people, it works quite well. It is a tricyclic antidepressant, so the dosage that people are taking is actually quite low. Because if you were taking it, say, for depression, which they used to prescribe the drug, they would, give you 150 milligrams. So, people are saying at 10 milligrams, they feel like a zombie. So you can only imagine if you were on 150. So I was up at 35 for quite a while. And then I started to wean myself down to 10 because I've been on it for a while. And, it's sometimes you don't want to be on a drug long term. So I've been trying to sort of get myself to, slowly, potentially maybe get off of it. I know that I still probably need the 10 milligrams, but hopefully one day I'll be down to 0, because I do a lot of other things now. I do yoga, and I try to really keep my stress levels down as best as I can. Because
What sort of activities do you do besides yoga to really lower your stress level? Because I know that's a big topic that you and I discuss that is very helpful for so many people.
Yeah. So for me, it's sometimes, going for a massage, or asking my husband to give me a massage, or taking an extra long shower, or watching Netflix and watching, a show that's kind of mindless for an hour or so. Sometimes just scrolling the internet, and just looking at stuff that isn't depressing. Like I'm obsessed with dogs, so I tend to look at a lot of, I'll watch a lot of dog reels, basset hounds, and bloodhounds, and it's just, for me, that's just very soothing. And I have a dog, so I like to walk my dog. I have a son who's 4, so I, spend a lot of time at the park and outside and doing things with him. The mindfulness meditation piece, I'll do that as well. I like to do restorative yoga. And and also just therapy. I find, once a week, once a month, it's always good to check in with someone, see how you're doing, how you're coping with everything. If there's something you need to talk about, there's really, I know it's still stigmatized, but it shouldn't be. Because I think everybody should have a therapist, and everybody should, especially when you have chronic illness, you should be checking in with someone. Because it's really it can be very, very helpful and help you get through, because life is stressful, and there's going to be stress in life, and you kind of just have to figure out how to, when you have a condition that is heavily affected by stress, you have to find ways that, you can manage it as best as possible.
That's true. And also, our bodies, if we don't release our feelings, they get trapped in and they can wreak havoc once they're trapped inside the body, right? So I think that it's always a good idea to be able to release emotions, release trauma, release any of that stuff that affects the physical body as well. Because that stuff, when we don't feel safe, then that also leads to pelvic floor tension as well, which exacerbates IC and those kind of, as you already know, but I'm just sharing for
yeah. No, I mean, like, I know that when, if I have an argument with my husband, the first place I feel it is my pelvic floor. And it makes sense because the pelvic floor is such an important space, right? It's where we, procreate, it's where we defecate, it's where all these important functions. So we're very protective of it. So it's often the first place where we feel tension. And people don't know that. They think it's going to go to their back or their neck or their head, but it's almost always going to go to your pelvic floor.
Yeah, it's the same as the pelvic floor feels it the same as our trap muscles. Like, I know that most people know that, okay, I'm stressed, I'm going to go get a massage for my trap muscles, but they don't realize it affects it the exact same way in the pelvic bowl, right?
And
So,
everything's connected, right? Like, so
mhm,
that's another thing is and I think people, they'll feel pain in a certain part of their body and think it's coming from that part, but it's not necessarily. And then they'll start feeling it, shooting up the leg and then going into their arm. And then they're like, oh, wow, this is weird. Like, why am I feeling so much pain all over now?
mhm.
And because the body's connected and everything is, we're just one entity.
Yeah, it's
So,
pretty cool. So what
yeah.
else did you do? So you said you took amitriptyline and you really worked on your stress. Was there anything else? Did you do any like dietary changes or like healing baths or anything like that?
For me, I've always been more of a shower person. I know that a lot of people find baths super soothing and, they'll use Epsom salts and essential oils and it's great for them. I just have never been much of one to just sit in water. I like a hot tub, but I don't know. It was just never my thing. When I was a kid, I used to take baths, but since then I just haven't been into it.
Mm-hmm.
But diet also big, yeah. So I kind of figured out what my trigger foods are. So I'll, for the most part, avoid them. I wouldn't say I'm on an IC diet. I'm not. I don't think anybody has to be on an IC diet. Maybe at the beginning, you can try it and then start, introducing foods back in, but it's very limiting. So I know, Callie Crazier, who does the 12-week IC program, will recommend that no one is really going to stay on that diet. And she gets people figuring out what foods they can eat, what foods they can tolerate.
Mm-hmm.
And yeah, so I basically know what I need to stay away from. And, but it's interesting because sometimes, like tonight I had orange juice and I usually try to stay away from orange juice, but
Mm-hmm.
it was okay. So, I mean, sometimes you can just chance it and hope for the best, and then there's
Mm-hmm.
things that you can do, like take pre-leaf before if you're going to eat something acidic. Um, if you're going up for spicy food, like you can always do that beforehand. There are certain things that I definitely stay away from. Like I don't drink coffee at all and I don't drink wine.
Mm-hmm.
Those are two things that I find I can't tolerate. Or just that, I'll go into flare mode if I eat those or drink those beverages. But I would say, yeah, like I eat oranges now. I'm eating way more foods than I used to, which is nice because it's,
Mm-hmm.
it means that like I'm in a better place. And I think that for me, like stress reduction is number one. It's 1,000% number
Mm-hmm.
one. And
I had like I was interviewing and asking different professionals like what was kind of the characteristics of like, people with pelvic and bladder pain, like what they see in their practice. So I asked like my naturopath and
Mhm.
I asked an osteopath I used to see, as well as a pelvic floor physio. So I asked in another group of like pelvic floor professionals that I'm in,
Mhm.
and it was kind of they said kind of the same thing even though they didn't know each other. They said similar stuff. So kind of and we talked about this as well, like kind of type A personalities, kind of, you know yeah, like you kind of like to get a lot done, and so slowing down is going to be important. Managing feelings is going to be so important, and that was really important as you were sharing. It was important on my journey as well.
Mhm.
Things that you don't think about, like internal triggers. So if you're have an intolerance to a food or something like that, that's an internal stressor on the body, right? So some
Mhm.
kind of stress that you may not think of as stress may still be stress. Your unconscious thoughts, like
Mhm.
people think about just the conscious thoughts that they think, but also I sent out a newsletter today, and also unconscious thoughts as well that are underlying, that you may not even know that exist, that maybe they don't
Mhm.
to the surface all the time or whatnot, can also affect the physical body.
Yeah.
There's lots of out of the box things that you just may not think that provides stress on the body, like so it's nice that we're bringing up this topic, so thank you for discussing that and
Yeah.
sharing
I
that.
mean, the other thing too, like just don't sweat the small stuff, right? Because I think I used to big time. I mean, I would just like worry about a stain on a, comforter and it would just And now I just don't care, you know? I'm like, what's the point? What's the point of caring about these like minute things that just don't matter? You
Mhm.
know, is it going to change my life? No.
No.
So it's just letting go of the little things, I think and I think with perfectionists, it's hard,
Mhm.
but you know, it's just, you kind of have to because it's not worth it. It's not worth the suffering, right? It's not worth, it's just not worth it. And I feel that life's short and you got to enjoy the moments. You got to be in the moment as much as you can, right? And
Mhm.
if you're always worrying about the future, or if you're worrying about the past, or if you're worrying about these little things, then you're just, how are you gonna enjoy your life, right? And how are you gonna
Yeah.
reduce your stress?
Mhm.
Kind of difficult. So
Yeah, that's good. Thank you for sharing kind of your journey with us. That is really good, and I'm happy to see. Like I've known you for quite some time now, so every
yeah.
time we talk, I'm happy to see. Okay, like you reduced this, and you're doing this, and like you're slowly getting there, and that's amazing. So thanks for sharing that.
Yeah.
I want to transition now and talk about Pelvic Health Support Canada. Like when we first became connected, I know that you were building that, and it's been here for a while now. I think, is it at least a year? It's been around a
It's
year.
going on a year, June 1st. So
Awesome. So
yeah.
almost a year. So I want to know what inspired you to create Pelvic Health Support Canada, and what is it for people that don't know?
Yeah. So we're a patient-centric resource for anyone struggling with pelvic health conditions, whether they're male or female. We cover all pelvic health conditions. So, you know, prolapse, incontinence, overactive bladder, IC, endometriosis, CPPS, you know, prostatitis, and you know the list goes on and on. Even we have persistent genital arousal disorder, Fowler syndrome. So all the conditions are defined, and you know we list the symptoms, about the condition, diagnosis, potential causes, treatment. So basically the site is set up very much so that people can sort of grasp the biopsychosocial approach. So it's, you know, when you're seeing your urologist and they're like, I'm sorry, there's nothing more I can do for you. We can't do surgery. You've tried this medication, that medication. I guess you're SOL. I'm sorry. You know,
Mm-hmm.
it's sort of the space to come when you're feeling sort of, you know, like there's nothing else for you to do. And I think you know, what we're really trying to push here is that pelvic health conditions are complex and you really need to take this biopsychosocial approach. It's not just a simple quick fix, unfortunately. So, you know, we talk about self-care and mindfulness meditation. We have videos on the site so you can actually practice. So you can take, you know, the proactive approach. We have a shop. You can purchase any products if you're looking for dilators or wands or Utiva products or lube or, you know, beverages like acid-free coffee. So we have everything there.
Mm-hmm.
And then we allow you to find help near you. So we have a directory where you can look for a naturopath or a pelvic physiotherapist or an acupuncturist or a chiropractor. And so you can basically find someone that can help you sort of more so in the holistic realm. We
Mm-hmm.
also have listings for conventional doctors as well. So we're not shying away from conventional. It's just it is, you know, more so getting into diet and lifestyle and focusing on the psycho and the social as well as the bio.
Mm-hmm.
Um, so yeah, so that's really our main focus. And it's basically a place where you can come and do anything, you know, learn about your condition. You can listen to um, you can watch videos that you know, by Lorimer Mosley and Carolyn Van Dyken and Shelley Prosco, who's the pioneer of physio yoga. So it really is a place where you can come and basically learn. Our goal is to educate. We have a blog. We post blogs every week by practitioners who, you know, are naturopaths, pelvic physios. You know, we have companies as well who have products that can be helpful. So it really is, like I said, a place to come and just basically learn and not feel so isolated. Um, it is a supportive community. We have a Facebook group as well that you can join. So if you have any questions, you can ask questions there. You can contact us also through the website. So it really is, like I said, a space for you to be supported. There's research articles as well. We provide all the information on supplements and what supplements are most beneficial for your condition. And then if there's supporting research to back it, we provide that. So it really is, and it's done in a way that it's a resource site, but it's very much we try to keep it very concise and easy to read, easy to get to where you need to be. Like if you're looking for something specific, we have recipes. If you want bladder friendly recipes, you can look up bladder friendly recipes. If you want to know if you're doing an alkaline diet, it will give you a list of foods that are alkaline versus acidic, and you can print that off, and there you go. So it, like I said, you can get pretty much everything you need off there.
That's great.
Yeah.
And what inspired you to create it?
My own journey was really much my inspiration. I would say, it was difficult. Like I said, back when I was diagnosed, there was really nothing out there. And I find that Canada is just terrible for pelvic health, right? We're just not educated in school about it. It's underreported, it's under-researched, it's underfunded. People don't know how they can get help, where they can get help, who they can get help from. It's just a whole big mixed bag. And I'm finding, we get a ton of traffic from not just Canadians, but there's a ton of Americans on the site. There's a ton of people from the UK on the site. There's a ton of Australians on the site. So people are using the site. You don't have to be Canadian to go on the site. The reason I created it is because of the lack of everything that we have in Canada. But again, like I said, it's not just for Canadians.
Definitely Canada, there's a lack of resources. It's better than it was because we both have had IC for such a long time. I remember as a 19-year-old looking, I'm 35 now. There wasn't many. I think I found 2 books, one written by a patient, one written by a physio at the time. That was it. And there was, I think I feel like there was an AOL group. I was going to ask you if you were in that AOL
group. Oh my
group.
God.
Were you in there?
No, I wasn't, but that's, oh my God, AOL, yeah.
Right? I think there was like an AOL, or there was like one group for people, like some website I found or something, but it wasn't active or interactive, so I still felt so lonely. I think I met like one friend there, and then I don't know what happened to them, and then the site shut down or something. Like has been, things that came and went, right? But with Facebook, I feel like it's been great. To be able to share resources with others. So I'm gonna post your links in the comments section below so people can find you. But where can people find you, for example, like a professional that's looking to do like some posts with your listings, etc.? And is it the same place as somebody would be able to find you if they're just looking for to join as a member, if they have IC or a different, or prolapse or diastasis recti, and they're looking to use your site as a resource? How can they join?
Yeah, so there's lots of options. I mean, you can do it through social media. Like I said, I have so there's Pelvic Health Support Canada Facebook group. There's Pelvic Health Support Canada private support group as well on Facebook. So there's those 2 groups. And then there's Instagram, which is Pelvic Health Support is the Instagram handle. So you can always message me on there. You can message me through Facebook, or you can message me directly through the site, which is pelvichealthsupport.ca. And you'll list it anyway, so they don't need to write it down. But so those are all, and then there's a contact section on the site, so you can also reach me through there. So there's lots of ways, and then same for professionals as well to reach me that way. And then I also have an email. They can email me through info@pelvichealthsupport.ca, so we can list all that and they can have all the contact info.
Okay, perfect.
Yeah.
So I have one last question. So
Yeah.
what words of wisdom or inspiration do you have for those that are newly diagnosed or those that are, in it for 20 years and they're just not seeing any sort of relief? Like what inspiring, hopeful words can you provide for our group today?
Don't give up. There is plenty you can do. And I think it's the harshest thing that doctors make you feel like there isn't anything you can do, and this is your life, and this is just what you have to deal with, and this is just what it is. And I think that was for me, and that's what took my, brought my mental health down. So that is really like my words of advice are just don't give up, use the website, get the information you need, figure out what foods, do the elimination diet, figure out what foods you can eat. You don't have to stick to these diets religiously. Do use the site, like use the videos. They're amazing. They're helpful. And if you get a membership, you get access to additional videos. There's a Dr. Michelle Chabon who did an incredible, she does a 45-minute body scan that's absolutely incredible. And she's the one who basically created the program at U of T for mindfulness meditation. And she suffers with terrible pain, and she was able to have, because she's so incredible at practicing meditation, she was able to have surgery without anesthetic. So pretty incredible. There's lots of other resources, and there's lots of free resources on the site. So just, get what you need, use it, connect, join our support group. It's, it's just wherever you can reach out. You're not in this alone. And I think people now are in a better place than we were, you and I, because there are more resources out there now. There are more ways to connect with people who have conditions that, that have IC or that have endometriosis or vulvodynia, right? So, or prostatitis. I don't want to leave men out of the loop. But yeah, so that's really what I, really like to preach is just hold on. You'll be, you're gonna get through this, and this isn't a life sentence. This isn't, you're not going to be suffering. You can get to a better place.
Awesome. That's a beautiful place to end this conversation. Thank you so, so much for agreeing to come and let me interview you and to provide some hope for everybody. And as I said, I'm so happy to see how well you're doing. I'm proud of the journey that you've had.